We are on Chapter 12, and basically this chapter is about treatment. How to treat mental disorders. We went over the main mental disorders last chapter, and so now we're going to talk about how you treat these things. And one of the ways to treat it is biological treatments. A biological treatment tries to treat some sort of biological difference or deficiency or maybe sufficiency of hormones or neurotransmitters, or could be cells that are malfunctioning. And you can treat them with drugs, you can treat them with surgery, electroshock therapy is the video we're looking at. So these are all ways to biologically treat the cause of a mental disorder. And so there are four main classifications of drugs that you have to know: antipsychotics, antidepressants, tranquilizers, and lithium carbonate. These are the four major types of drugs to treat various mental disorders. And you'll hear a lot about these throughout your lives, so it's good to know them. Schizophrenia, what we studied yesterday, is treated with antipsychotics, also called neuroleptics. And I have a list of antipsychotics. Thorazine is one. Have you ever heard of Thorazine? Here's a list of antipsychotics. You may have heard of some of these. Thorazine, Mellaril, Thiaril, Serentil. A lot of ills there. Haldol, you may have heard of that one. Sometimes if you watch these TV shows, you know, where they rush them into the hospital, the mental ward, you know, give them a shot of Thorazine. Give them 20 cc's of Thorazine. You ever heard anything like that? You can see from this table there's a lot of different types of antipsychotic drugs. And they all have little bits of differences, different side effects. So this is what you give somebody with schizophrenia or some other psychosis like schizophrenia to quiet the voices in his head, stop the hallucinations, try and become more normal. Sometimes that works. Sometimes it doesn't work. But you can see there's a long list of drugs that you can try. Now, for people who are depressed, if you have depression, anxiety disorders, OCD, remember the video of the OCD we watched? There are various antidepressant drugs you can give to help with those disorders. You ever heard of Prozac? Elavil? Lexapro, Cymbalta? Have you seen these things advertised? Paxil, Nardil, Zoloft. These things are all over the TV. Depression is one of the widest symptoms in the world, and some experts say that over half of people at some point in their life will be clinically depressed. That's half of us. We got 20 people in here. That's 10 of us. So you may have to take one of these various antidepressants at some point. It's good for you to know what they are. You don't have to memorize this list. I'm just showing you examples. I'm trying to show you there's a lot of drugs out there for this kind of thing. Again, different drugs have different side effects. Some work better on one person. You know, Paxil might work great on one person and not work at all on the next person, because one's body chemistry is different. So this column is the classes of drugs. MAOI, SNRI, SSRI. They're different classes, different basic molecules that the drug is fabricated out of.
Dun dun dun. She's late.
Quick.
Yeah, what's fast?
What's your excuse, Leah?
Tranquilizers. People with mild anxiety. This is just a little bit of stress. They're often prescribed tranquilizers. Valium. Have you ever heard of that? Here's a bunch of different tranquilizers. They're also called sedatives. Maybe you see it on the medical show. Just give them a sedative, calm the person down. They'll often give you a sedative or a tranquilizer when you go in before surgery. Or they'll even sometimes give some to you, like if you're going into the dentist or something like that. Because some people are so stressed out that it helps them relax. So Valium, Luminol, Amitol. I think that's luminol with an O. To see blood. Xanax, Ambien, Lunesta. We've seen that advertised, right? So those tranquilizers are sedatives, and these drugs, I know are abused. If you take a sedative, it's going to make you feel calm and relaxed, and some people abuse those drugs. And then finally, lithium carbonate. That's just a single drug. There's not a bunch of different types. Lithium carbonate is used to treat bipolar disorder. Those are people who are up and down, and it just kind of takes away the highs and the lows, kind of evens you out. So lithium carbonate for that. So check this out. 4 types of drugs, 4 choices, multiple choices, multiple choice test. Huh? See? Lithium carbonate is used for A, bipolar disorder, B, mild anxiety, C, depression. Very nice. See how this works? Now, drugs are great. You can treat a lot of things with drugs, and some people rely completely on drugs. But there's a lot of problems with drug treatments. One is the placebo effect. If you take a drug for something, you will have an expectation that that drug will work. And often the expectation causes the symptoms to decrease, even if the drug's not doing anything. We call that the placebo effect. If the doctor says, here, take this, it'll get rid of your anxiety, and even if he gives you a sugar pill, and you take it, you'll probably get rid of your anxiety for a while.
Why is that bad?
It's not bad, but you have to be careful when you're a doctor and you give somebody a drug and they say they feel better. That's not necessarily because of the drug. And usually the placebo effect goes away after a while. This is true for a lot of things. It's even true for surgery. My dad used to tell me that he'd do surgery on a person, fix them up or whatever, and not all surgeries are successful. Sometimes the thing they're trying to fix re-injures itself or something, but the person, because they had the surgery, will often say they feel better even if the surgery didn't go correctly. So as a doctor or as a psychologist, psychiatrist, you have to keep the placebo effect in mind. Maybe the drug's not really working and some other drug would work better, even though they are feeling better. That could be because of the placebo effect. There's a high relapse and dropout rate for drug treatment. One of the problems with drug treatment is you got to take the drugs. And a lot of people forget to take them or stop taking them. Most of these drugs have side effects. If you're taking a drug that calms you down, it might calm you down nicely, but all of a sudden you lose your appetite, or you feel nauseous, or you can't have sex anymore. Some of the drugs make you kind of impotent. So, people will say, well, I'm not doing this anymore. The side effects are too bad. So there are high dropout rates. There are high relapse rates in that, once you stop doing the drug, the problem's still there, and you go right back to the problem. So that's, something that you have to look out for if you're taking drugs for something. Dosage problems refers to the idea that if maybe you need 10 milligrams of the drug, and maybe this other person needs 100 milligrams of the drug. And maybe 10 milligrams of the drug doesn't do anything for this person, but it might be an overdose for this person. So you don't know exactly how much to give a certain person because everyone's body chemistry is different. And so sometimes you have to experiment with the dosage to see what dosage works on what person. And then the long-term risks refers to the idea that a lot of these drugs, we don't know what the long-term effects are. If they come out with a new drug, let's say this new drug really treats depression really well, and a person is taking it and, gosh, they're not depressed anymore, and it doesn't have hardly any side effects. Great drug, right? Wrong. So you're going to take the drug for 30 years. What's it going to do 30 years from now? It might have some build-up effect, something maybe it builds up in your liver or something and damages it. A lot of these drugs, they don't know. They're not going to test a drug 30 years before they release it. There's a year or so of testing, and if it seems to be working, they release it. And so a lot of the drugs out there, we don't know the long-term side effects. There have been drugs that have been out there for 30, 40 years, and you can pretty much tell because not a lot of people are complaining that there's no real bad long-term side effects. But most of the drugs, we don't know that. So you're often, these long-term risks, you're taking that into your own hands. You're just hoping that there's nothing real bad about it. So, and that's another bad thing about a drug is, if you have some problem, you may have to stay on it your entire life. And so drugs aren't always the best answer for treating things. If you can treat a disorder without the drugs, you often want to do that. Another problem with drugs, I don't have it listed up here, drugs are expensive sometimes and cost a lot of money. If you have to pay $100 a month for your drugs, that adds up over a lifetime. Some drugs are even more expensive than that. So there's all kinds of problems with drugs. Now another thing, but drugs are good. It's one way to treat. Some people need the drugs to survive, so you have to weigh the good and the bad. Sometimes surgery helps. Psychosurgery is going into the brain and cutting out diseased portions of the brain, or maybe reconnecting nerves in the brain, or so forth. A surgical procedure that destroys selective areas of the brain believed to be involved in emotional disorders or violent impulsive behavior. A lobotomy is a form of psychosurgery. They go in there and destroy this portion of the brain that's bad, and maybe that'll make you better. And so we call that psychosurgery. That's not always an option. For some things, they don't know. There's not any one portion of the brain that's problematic. But for some things, there are. And then ECT, this is the video we're watching. And what they use that, electroconvulsive therapy, also called electroshock therapy, they use that to treat depression. For some reason, if you give an electric shock to the brain has a temporary seizure, and for some reason that helps cure depression, and nobody knows why. For some people, the depression goes away for a few weeks, a few months, and then comes back. Some people, it goes away forever. And some people, it doesn't work at all. And there's no way to predict on a person if it's going to work or not. So that's what this video is we're watching, about the lady getting electroshock.
when in that video, is the video like it's videoing it as it's happening, or is that just like, what do you call that? Or they just, yeah,
No, this is real. Okay. Yeah, they were that's the actual lady, and they were filming it. It's a documentary, I guess. Is what you So next time, what we'll talk about is other ways to treat psychiatric problems, and the next thing is psychotherapy. Getting the person in your office, talking over their problems. Sometimes that works better than drugs. Some people are depressed because they don't have anyone to talk to. If they can talk to their therapist, it fixes them. So, and you know, there are other problems, things you can figure out. So that's what we'll talk about next time. All these different types of therapy that you can go to. And this isn't, you don't go to a psychiatrist necessarily for this therapy. Psychiatrist is usually to get the drugs. There are all sorts of therapists out there that you go to and sit with and talk to, and they sometimes specialize in treating certain disorders, and so we'll talk about that next time. For the rest of the class here, I'm going to continue this